most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course,
How
Bob.
do I say that with a straight face? Today, we're going to talk about how to decompress your back, your mid-back, fix your pain. Plus, we're doing a giveaway, Brad.
Oh, outstanding. But the giveaway is
At the end of the video.
Right, so
You
just-
got to wait around. It's fantastic.
It is
I'll
a big,
guarantee you.
it's a big giveaway.
All right, Brad, let's
But
get
Bob,
right into it.
what are you talking about? Mid back. So we're talking
Oh, yes.
shoulder blade area.
Right. Why don't you show them on me, Brad?
Yeah. So stand up nice and tall, Bob. Ooh, I got to reach up. So we're
Long
talking
spine.
here, not here, but we're talking about right here at the thoracic 12 vertebra right in here. And there's some
Starts at T1,
Yep.
which is thoracic 1.
Yep,
Goes
T1.
down to thoracic 12.
Right.
Which is about 5 below the shoulder blades, right?
Yep.
Shoulder blades go to
Yeah.
about T7. So any pain within there, sometimes the pain might get referred down further.
Sure.
I've had that quite often, Brad. Quite often, if you don't mind, turn around.
Oh, now it's my turn.
Quite often when I feel pain in the low back, it's actually from the mid back.
Mm-hmm.
It refers down.
Right.
Pain for the low back often goes down into the back.
Right.
So my go-to treatment when I was treating people in the clinic was using Mulligan and Syriax. That's two.
Physical. Well,
One's a doctor. One was a doctor,
orthopedic doctor, right?
and one is a physical therapist. I think he's still alive.
Brian Mulligan.
Yeah. So I would have people lie down like this. The patient. They put their arms out like this. Their legs would be out, and I have an aide pull on their arms.
grab the wrist here.
Yep,
and
go ahead, pull,
this-
Brad.
You want me to pull
Wow,
you?
you can do it just like that. That feels good, actually.
So you're not pulling really hard. You don't have to have a big bruiser. Just someone that gets some traction.
Yep, and then I'd have somebody pull on their feet at the same time.
Yep. Grab around the ankles. I would oftentimes use a towel. It was just a little more comfortable on the ankles, but that's not that important for this discussion.
God, that actually feels good right now.
Well, of course, Bob. I have a way with traction.
Yeah, apparently you do. So I wanted to figure out a way that we could do this on our own.
Without
Yeah,
having
right.
three, because then while there was traction,
While there was traction, I was working manually on their mid back.
right? Mhm.
And I have to say, I wouldn't say it was successful 100% of the
Mhm.
time, but it was a very high percentage.
Right.
that
Felt
people-
comfortable with success.
Now, what I would always work on is I would first check their motion. So you want to check your motion, and the main motion of the mid back is rotation.
Right. Right.
So I would check which direction hurts. So I often would have them cross like this or
Right.
like this, like I dream a genie. And you go ahead and turn to the right.
Yep.
Does that hurt? And is it restricted?
Mhm.
Then I also
or
turn to the
painful
left.
too, right? Yep.
Yeah,
So the motion and pain kind of take note of those.
right. Or one or the other.
Yeah.
I mean, and that I would not work into that direction.
The painful direction.
Right.
Right.
We're going to show you how that works in just a minute, but I have you work into the non-painful direction.
And I do want to mention, if you do assess your motion, make sure you're doing it in a seated position, not
the pelvis
standing.
should be stable,
Right.
and by sitting, that it is stable.
Right.
First off, too, I want to mention you shouldn't do this on anybody who has rheumatoid arthritis,
Mhm.
or if you have a lot of laxity or double jointed.
Right.
I don't want you doing these.
Or if you've had any previous surgeries or things like that on your spine, those red flag things. What about if they're bone loss, osteoporosis or osteopenia?
Yeah, I'd probably be a little careful with that too.
Right,
I
so-
think I would hold off on that. You're
so
right.
typically,
Brad.
if you're older, over 16, you have some bone density issues.
Yeah, I don't have any problem probably with just hanging.
Yep.
But I don't think I'd add the twist to it.
Right. Yeah. Well,
So-
we can mention that again as we show it.
All right, Brad. So we know now, let's say, for example, that we found out that twisting to the right bothers you. Now we got to show you because it's actually got to be opposite with hanging.
Right.
And Brad's going to be our subject today, but we're going to use the hanging handles. These work really well because while you're hanging, the wall supports you.
Right. And the hanging is using your body weight with gravity to provide the traction that Bob, what we mentioned earlier, where it had two people assist with. So it's an independent. So should we
Yeah,
jump
let's
right in?
jump it right in, Brad.
So if you have something to hold on, we use the hanging handles. If you had a pull-up bar, it works, but it's best if you can.
The
So-
pull-up bar is a little bit problematic if you're out away from the wall.
Right, because then you've got a gap
Yeah.
there.
You need the wall to support you
Yep.
while you're doing this.
And it actually, I think it really provides some comfort, and you can tell it gets your back in alignment. You can really feel if you're straight. So I'm going to slowly, and plus when you go down gently and slowly with your traction, the friction of your back against the wall is very helpful. Allows some real good
And that's
control.
the first, like Brad is mentioning here, the first thing you're going to do is just work on traction.
Yep.
You're going to slowly work into it. It might be a couple days that you do this.
Sure.
Even, and you can control the amount of traction you're getting
Right.
or decompression by your feet.
Right. Yeah, because right now I'm probably I'm guessing 50% of my body weight. It feels pretty good. And if you're doing this for the first time and you go all your body weight and it hurts, stop. Just go to
Right.
the point where it feels good. Give it some time. It may take a few days for things to decompress and get to normal. And
This is not a painful maneuver.
no, if you're feeling pain, you
Right.
stop. Yep.
And that's how it was when I was treating patients. If there was pain, we stopped.
Right. Yep.
Right, immediately. So now, what's weird about this, Brad, is turning to the right like this
Mhm.
is actually similar to moving the legs to the left.
Right.
So we're not going to have Brad move his legs to the left. We're going to have him move them to the right.
Because turning to my left.
Legs to the right is like turning to the left, and
Oh,
his
excuse
left
me.
direction was fine.
Yep.
It was his right direction. I hope this isn't too confusing.
Well, the big thing is when you do this, only go the non-painful
Right,
direction. That's
right.
the easiest way to remember it.
Yes. So you're going to use this, right, Brad?
Yeah, that's what I use, and I think it.
Well, you can use a chair or a stool.
Yep.
Or,
So let's say I'm to the point now where I feel comfortable, feels good to have the traction on, and I can hang there as long as my grip is fine. 20 to 30 seconds maybe or less. I personally go a little less than that, but now I'm going to go to the right and feel how it feels. Like, oh, that feels
yeah,
good.
it's just starting a little
Yep.
bit of thoracic or mid-back rotation.
Right. Because we mentioned before, rotation in the spine, the majority is from the thoracic spine,
Yes.
not the lumbar or the
way
low
the
back.
bones are shaped,
Yep.
they promote rotation.
All right. I'm going to come off and give a little break because I need it. But
Yep.
I'm going to go
Now,
back
Brad
to
does
it.
have an involved back.
Right.
He has spondy.
Yeah. So this one I don't do because it doesn't bother me for short periods, but I wouldn't do it on a regular basis. So I'm going to rotate this way, assuming, oh, that feels good. Everything is going good. It actually feels better. You might put your foot up on a stool there. You don't necessarily have to do that,
Right.
but you can trial with level here or here. And
The further you bring your feet, the higher up the thoracic spine you go.
yeah. So
So-
this might get to my, low shoulder blade level, but when I get up in here, it may be up to that,
Right.
just probably just below the neck, but up higher for
You
sure.
can imagine T1 through T12. That's how they number them.
Yep,
You start off, you're just hitting T12,
yep.
but once you get your feet way up like this, you're probably getting up to T4, T5.
This actually feels good, but part of the reason is because I'm flexing my low back a little bit. But right now, the only thing that's limiting me is my grip. I need a little break.
And you got to be aware of that because we don't want you to fall.
Right.
Brad's going to show what he does with his spondy.
And
Kind of a bonus here.
yeah, spondylolisthesis. I believe there's a component of stenosis with my back. And if you do have stenosis, this is probably going to be helpful for you. Again, same rule. If you do bring my feet up to here and hang, if it clearly feels better, you would continue. If it hurts, stop. Always follow the rules. For me, I go up to here and it clearly feels better on my low back, right around the belt line. I can feel that stretch. And if I give a little
Twisty?
Is this the booty
I
thing?
don't know
Whatever
what
the
that
hell
is.
a booty is. I'm not really sure if guys have one or not. I don't know. But anyways, this
Old guys
feels
don't.
yeah. We've got a video on that flat butt
Flat
thing.
butt,
Yeah. And good.
So after you do this, I want you to retest. I want
Oh,
you to
right.
sit down and actually see what your rotation is like. So originally Brad's rotation, pretending, hurt to the right.
Right.
So we went like this and he rotated to the right.
Ow,
Ow!
Yeah.
Now he worked on going to the left, but that often improves rotation in both
Right.
directions. So you might try it again and say, oh, I'm going a little bit further, or oh, that feels a little bit better.
Yep.
And you know you're doing the right thing then.
If you go back and for some reason it's worse,
Right.
then you're
Probably
going to
won't be
hold
doing
off
this.
on that. Yep. So very cautious. Make sure you take your time with it, and do not, no pain, no gain is not what you
So
want
Brad,
to.
people are waiting.
Oh
in
my goodness!
suspense.
Yes, we do have the big giveaway, and this is big. This is worth hundreds or over $1,000.
Right.
It is a mattress, and it's a high-end mattress.
It's a Sleep Ovation
Sleep
mattress
Ovation.
with 700 tiny mattresses.
Yeah, you can see them now. You don't get it like this. There's a nice cover that covers the whole thing, and air channels provide cooling. There's a nice springs on the back half, which allows I don't know what it allows, but it makes me feel really good when I
Yeah,
sleep.
they really know what they're doing. You just got to go to the giveaway section of our website,
Oh, that's
bobandbrad.com,
Yes.
and you can sign up. It'll also be on Facebook.
It's pinned to the top of the page.
Pinned to the top of the page.
Yeah.
I can't tell you, Brad, how many family members, friends
Yeah.
I've had that came in.
Yeah.
And, I didn't ask them at all. They just said, that was the best night's sleep I have ever had.
Yeah.
I mean-
how much you give them to drink the night before?
Well, yeah, well, that probably helps too. They pass
Just
out.
kidding. Just kidding.
That's part of
Right?
the Schrupp household. All right. Thanks for watching.
What are people going to think?